time with you guys today, but we want to go ahead and focus on certain things with what we do at AAA Physical Therapy. So with our banner here, and one of the common ways why you work with a physical therapist, but before, maybe instead of me answering that, why do you need to work with a physical therapist? Let me ask you guys. Why do we need to work with a physical therapist? When do we need to?
Because you know how to work with certain areas in the body that could be afflicting us. You know.
And when you say afflicting, what happens there? When you say affliction, what's another
We're
word?
having pain and discomfort, so you kind of help us to deal with the pain and make it better.
Exactly. So pain and discomfort. And that's the first part of our Path to Wellness program, the relief component. And that's where Marwin and our other awesome physical therapists at AAA Physical Therapy, and again, I know you just joined us here. We are just about 5 minutes from here. So you turn left on the street right here. What street is this again?
This is Guilford.
Guilford, right?
To Oakland Mills.
Turn Guilford, turn right to Oakland Mills on that stoplight sign, and then cross Snowden River Parkway. And the first one that you can turn right, you turn right, and we're right there. But again, we will help you, at least with the first visit, with Marwin visiting you here. Because one of the other things that he can do as well is home safety evaluation. So aside from the pains that you have, he can go ahead and identify that your home is safe. And I could see you have that walker over there, okay? But why do you think we need to have home safety evaluation? Why do we need to be safe at home? What is going to happen if we're not safe at home?
So we prevent accidents and things.
And what's a typical accident that's going to happen?
Fall.
Fall. That's why we have this event right here, because it's fall season, right?
Yeah.
So we love the fall season.
And then we can say, I've fallen right there.
But we don't fall. Are we 100% clear with that? Yes? Okay, so that's another thing why working with a physical therapist would be helpful for you guys to go ahead and do. Great? Okay, cool, thank you. Anything you want to add regarding pain management and fall and home safety evaluation?
You mentioned home safety evaluation. Well, we can also do like ergonomic assessment, see if, for example, the height of the chairs, the height of the tables, if you like use them often, that can also contribute to your posture, and that adds pain. That creates pain, you know, wherever in your body. You know, so it's not just for fall, but it's also for pain. The home safety evaluation is not just for fall; it's also for pain. Yeah, and he mentioned also the relief from pain, as I was mentioning to you, ladies. We do a lot of techniques. We have a lot of different modalities that help address these pains that you're having. What makes us different from other physical therapy places is that we just don't let you do all of the exercises, but we try to make it special for you, but we're more on hands-on stuff, like manually treating whatever's causing the pain. Right? Not just chasing the pain away, but try to determine what's causing it and try to get rid of it.
That's why we're paying him the big money.
That's why we need him.
That's exactly why he's here. Thank you for that. Great. And that's the thing. You guys ask, okay, so once you're done with pain, that's what it is. You feel relieved. But just like what I'm seeing from your shirt, I run like a girl. So, running like a girl, if that's something that you want to continue to do, hopefully we can go ahead and move you into that direction, where we have Restore and Gym, so that's where we go ahead and come in as a personal trainer, all right? Fit and Life. So you don't go ahead and identify. Here's a common question that we want to ask you guys. The older we get, the more we should go ahead and fall or lose our balance. Is that a fact or is that a myth?
Not a myth.
I hear a myth, I hear a fact. Why is it a myth? Why is it a fact?
It's a myth that you don't want to fall.
Yeah, yes, we don't want to fall, that's great. But why do you think it's a fact that the older we get, the higher the chance we fall?
Because you get older and your gait is off.
Right.
Your balance is off.
Right.
So we need to be.
What is it? Is it a myth or a fact?
So we need to get like
It's hard to say without citing some evidence.
Yes.
Without citing some evidence. But age is definitely a factor of it.
Age is a factor, yes, but definitely, for the most part, as long as we continue to be active,
Right.
we're leaning towards it's a myth.
Exactly.
Because if you continue to maintain your balance, having an active, healthy lifestyle, the choices that you eat, and all of these other factors, that's why it's not going to go ahead and say, oh, okay, I'm 75 years old, I need to fall now. No. Gravity doesn't know what your age is. Does that make sense?
Yeah.
Yes.
I mean, right now we are treating somebody, he's 92 years old and he's still running right now. So yes, there are many other factors involved.
Age is
But-
just one. Yeah, it's
Yes.
one of the intrinsic factors. One of the factors that there's nothing we can do about. But there are a lot of other extrinsic factors that we can definitely help with. For example, muscle strength, your balance or proprioception or proprioceptive ability. That's your ability to position yourself in space. Those are the things that you can definitely change or train with the help of a physical therapist.
Yep. And that's where it'll go ahead and come in. Okay? All right. So, this is our Path to Wellness program that we have here. In our clinic, we also have a massage therapist go ahead and come in. For the most part, she's there on Sundays. And she is also a physical therapy assistant. So we really approach the massage from a medical point of view and not just feeling good. Does that make sense? So if you go ahead and identify, hello there. If you go ahead and identify you have back pain, then she would be able to go ahead and approach it from a more therapeutic point of view. We also have yoga classes in our clinic on Saturdays. And you know what's awesome about her? She plays live viola music while we have yoga classes. So it's not music coming from the speaker. Yes. So if you guys want, maybe we can set up something here with a yoga class. Do you think there would be an interest here?
Yeah, we can set up a class and do the yoga here.
5 or 6 of them.
Yes. Yoga for
Find something, maybe they'll get interested.
yeah. So yoga for better sleep. That's one of the things that we focus on, of just calming things down. And I think this is a great venue for that.
Yeah.
Okay. So I'm going to go ahead and talk to your area person there. I don't want to tell her name, and then now we identify where we are. All right. Okay. So, excuse me.
I think that would be a good idea for a lot of people here. Because some of the people that live here really can't get out. So this would be convenient, you know, just roll in their chairs or their walkers or their cane.
Right.
And, you know, just come in here, you know.
You know, there was a lady that lived on the 2nd floor. And I guess I stayed here about 5 or 6 years. And I never, ever saw her. Really? Never did. I used to go to the door and knock and stuff. When you come to the door, like we put out the Christmas cards, you know, knock the door, she would never come out. I don't know how she got them, but she got them off. I guess after everybody lived.
But you know, I think that sometimes as neighbors, we all are, when we see someone like that, sometimes they need a little bit of encouragement.
Yeah.
Because, you know, some of us, as we get older, we become fearful.
Right.
And there's a lot of things that we don't want to do anymore. But if you have someone to kind of push you a little bit, and then, come on, let's do it, you can do it, come on, come on. You know, okay, I'll try it. And then they try it and they like it, and they're like, now they're calling you, listen, don't forget to come and get me.
That's
So
like
that's
the
a
lady
good
on
thing.
the 3rd floor.
Yeah.
She used, when she first moved here, she used to come out and walk the hall and all that stuff. She don't come out now. Unless her daughter comes here and take her out, then she'll come.
And for a lot of
But other
us,
than that, she just
you know,
sits
that's
in there on that
important
couch.
to stay active.
Yes.
Because if you don't have mobility,
Couch runs
nothing,
people.
you know, you just get sicker.
Don't you
And
think
your
so?
muscles really get tight.
I'm naming you president of this building right now. Vice president, secretary, sergeant of arms. Yes, all right. You guys are already the officers here. And that's what it is. You're absolutely correct. If that social facilitation to go ahead and help one another out. And I understand that we want to go ahead and put these boundaries. I absolutely respect that. But if it's something that will help us get better, and again, of having a community, of having the same goal of being healthier as much as possible, why not? Okay? So I'm glad that you guys are looking out for your neighbors. I mean, that's the thing. You can only share it to them, and if they take it, then they take it. If they don't, it's okay. But at least you offer.
It's all right, it's there
Okay.
for them if they want it.
Yes. And so, yeah, so those are some of the things that we go ahead and do. And like what I mentioned, we would prefer to have a little bit more of individual interaction with you guys, but at least we want to go ahead and share this thing with you guys as a group. And two more things that I want to go ahead and share here is that if you have a computer that has the internet access, I have some YouTube videos regarding strength through stress. Here's my question. Is stress always bad and detrimental to you?
Definitely.
Indeed, yeah.
Definitely.
Does anybody view stress in a positive way?
What do you mean, positive? Oh, to work out when you're feeling stressed out, try to get motivated and do something.
What about physical stress, for example? Do you think it's good or do you think it's bad?
No, that's good.
Yeah, so there are other
Yeah, that's stress out.
exactly. So there are some types of stress that is also good for you if it's graded, right? It's not just like a full-blown stress being thrown at you, but it should be like gradual. Like gradual stress can also be good for you.
I mean, like,
And that's what we want to highlight, and that's what I'm highlighting with the videos that I'm making, is that we always have this view of stress as always something that is bad. But we need to have these stressors in order for us to strengthen us. Good morning.
It makes you more resilient.
It makes you more resilient, and that's one perfect example right there. Why do you need to go ahead and walk? Because you're putting stress on your muscles to continue for your muscles to have that strength. Right?
Yep.
Does that make sense? So we have to go ahead and view all of these other stressors. Okay, how is this strengthening me? And that's why instead of me, because the common phrase is stress management.
right.
No, let's use the stress to strengthen us.
Right.
What can I learn? How can I get better? And so on and so forth. So I have those YouTube videos on our website, so feel free to go ahead and watch that. That's one of the message. And then the other thing, I know you guys are very much politically involved, and this is obviously the election time, or just happened, okay? And we have Local Health Improvement Coalition here, and it's the government and private institutions finding ways to go ahead and have better access to care. Another angle is also geriatrics or senior population or the advanced age group. The other subgroup that they have is weight management, and the last group that they have there is regarding mental health. Okay, so these are the four main sections that we are trying to go ahead and approach. You as citizens, which is very important to this community, you can definitely attend these local health improvement coalition meetings. So for example, I am a member for the advanced age group, or seniors or geriatrics for that matter. We meet every Monday at 2:45 to 4 o'clock. You guys are more than welcome to attend. And share your voice about what issues that you have. It's at Dobbin Road. It's one of the government offices over there. It's just very close to our office. So yes, it's just very close by. Good morning. Thanks for being here. So yeah. So as we go ahead and wrap this up, do you have any other general questions, and then we will attend to you guys individually.
Well, I don't have any questions, but I would like to say that what you suggested about talking to the manager and get something started would be a very good idea. See, I've been here a short time. I've only been here about a year now.
Okay.
So, and there's other people that have been here much, much longer than I. So I don't want to step on anybody's shoes because basically, you know,
Here's
it's like their place here. But I feel that would be a very good thing for this building.
Right.
So that other people, seniors, can get involved and have more activity.
Right.
Because a lot of them, you know, when it's like they say, you know, when your brain is not doing nothing, it gets lazy.
Right.
And you get Parkinson's, Alzheimer's, all kind of brain things, because your brain is not doing nothing. Your body's not doing nothing. Your body starts to break down.
As the phrase goes, use it or lose it.
Yeah.
Right.
And that's a very good idea.
Thank you.
We can get something like that here.
And you guys will be our spokespeople. And all we do is just offer.
Right.
And if they go, then they go. If not, then here's the deal. If you mean well, if we mean well, and if they say no, we can still sleep well at night.
Right.
Because we meant well.
Yeah.
Nothing
But
more,
it's
nothing
also
less.
offered to them,
So-
and if they want to do it, fine, and if they don't, you know, then it's on them.
Right.
But I think it would be a good idea.
Good idea.
Sounds good.
Yeah.
All right, well, we'll definitely go ahead and touch base a little bit more to go ahead and see how we can make that happen. And I know you guys will be our spokespeople.
Right. Hey, you're right.
So we're definitely gonna let them know, but you also have to let your voice be heard.
Yes.
Right.
All right.
Yes.
All right, Marwin, any last words? And as we go ahead and end this big group discussion, anything else you want to go ahead and share with them?
Anybody
Yes, go
can
ahead.
help smoking people? Is there any way we can help smoking people?
We have a smoking cessation programs at LHIC.
Oh, yeah.
Yes.
So we got some here on the number smoke.
Yeah.
Well, again, all we just do is offer.
I don't know.
And if they want to go with that direction, then yes, there's help.
Yeah.
Thank you for bringing that up.
Uh-huh.
All right, Marvin, anything else?
Some of these smokers here are killing themselves.
I tell you.
Yeah. I mean, they just go out and smoke, come in and die, and then they go another group to start smoking. And they just come back in the place to die. And then
Yeah.
they have to come and get them because they found them in the bed dead. It's bad.
Right. All right, just to add a few more things, he mentioned about function and for a gym and fitness, for example. What we can also do for that is, let's say you used to enjoy tennis, for example. And if you're not able to do that anymore, we try to come up with a different activity that's almost similar to that. Like, for example, balloon tennis. So you're using the same muscles, but you're just you're doing a different activity. Well, you're modifying the activity, but you're using the same muscles,
Right.
right? So it's not just to restore you or to bring you back to that level of being able to do a specific activity. We also modify it for you, for you to be able to do that. All right. Well, do you have any other questions with regards to physical therapy in general?
Not right now.
Sounds good. Thank you.
Like I said, just coming here, just coming here, I think is a great idea.
Thank you.
Because like, me, myself, personally, I get out of here at least 3 or 4 times a week, like I was telling him.
That's great.
And I go to my center and I do my exercising there.
That's good.
But when the weather gets detrimental, who wants to be driving out there? Yeah, exactly. So if we had something like that here, that would be perfect.
Perfect.
We come here and sweat our bones
Oh,
off.
right, I know.
All right, we're going to be wrapping the video
Okay.
up, and then we'll be attending to you in the
Yes, and again, thank you for being here this morning. To those who are watching live or watching the replay, good morning, thanks for being here. We appreciate you guys, so we'll end the program right now, and again, thank you.